And good morning, everyone. This is Amy Gibson with the Patient-Centered Primary Care Collaborative. Welcome to everyone who has joined us today for our open forum call on our Center for Care Delivery and Integration. So today we're going to have a really unique opportunity, and I hope all of you will take this as a chance to really give us your input. So a few things that we want to accomplish on today's call/webinar. We want to reintroduce you to the center, get you up to speed on everything that they've been working on, introduce you to the leadership for the center, but we also, more importantly, want to really solicit all of your input and feedback about the strategies and objectives that the center is hoping to accomplish over the upcoming year or so. So there's going to be a lot of different ways, and I'll get into the specifics on that about how you can participate in the webinar today. So just to remind everyone, we had center leadership. Our cabinet came together for each center and had some amazing face-to-face meetings in the month of January. And they really had a chance to redefine the goals and objectives for each center, talk about some tactics and ways that they'd execute achieving those objectives, and then really thinking about how does that fit into the larger context of the PCPCC and really focusing on our overall mission of promoting and advancing primary care in the patient-centered medical home. So now this is your chance to really weigh into that and really have your voice heard and really help us get a different perspective, because certainly we have some amazing leadership on each of our cabinets, but we really want to hear from all of you too as well, since many of you are doing this boots on the ground, working at trying to achieve patient-centered medical home every day, interfacing with patients, and also for those of you who are policymakers and part of large national, state, and even local organizations. We really want to get your perspective on everything that's going on, so that's really important for us. So just to let you know, again, this is not going to be your only chance to do this. We're going to continue to hold these quarterly calls and have the opportunity for you to have your voice heard and your input into everything that we're doing. So this is not a one-shot only deal. We're going to come back to you again in a few months and get you up to speed on everything that we're doing. Of course, we'll continue to provide updates on our website and through our newsletters. But there will be more than just today's opportunity for you to participate in what's going on with the center. So again, I really encourage you to be active participants today. We have a lot to go over. So without any further ado, we're going to start moving through the slides. Hopefully all of you have been able to sign in onto the webinar. And if you're just on the audio, that's fine too. We'll be talking through a lot of this information. But certainly to get the biggest bang for your buck, so to speak, the best way to participate is through your computer, because it gives you a lot of options. So just a quick overview on the agenda for today. We'll go over and review the stakeholder centers and how they're operating and really are the intellectual base and think tank for everything that we're doing at the PCPCC. Talk a little bit about our center communications, and then we'll get a chance for you to really interact with our co-chairs for the center, Blair Childs from Premier, Ted Epperly from the Idaho Family Medicine Residency Program, and Sana Kim from the AAP. So they're going to lead you all in a discussion about the goals and objectives and really get your input on a lot of the tactics that we're looking to achieve over the upcoming year and so. So again, let me just describe in a little more detail about the different ways you can participate on the call today. So through the webinar technology, we have several different options for you. And again, we really want you to be active. So feel free to take advantage of all or one or whichever is easiest for you. So we're going to have several polling questions that will come up, and you'll be able to click your answer. Sometimes there's more than one option to do that. Try to respond as quickly as possible to the polling questions because we really do want to get your feedback, but we have a lot of information that we want to give to all of you and time for discussion. So if you can click on there as quickly as you can and respond to those questions that we put up in the polling, that would be really helpful to us. There's also going to be question and answer portions of the call. So after each of the polling questions come up, once we get into the objectives and tactics, you'll be able to literally raise your hand. Now, you should see on the dashboard the option for you to click on the button to raise your hand, to get in the queue to say that you want to ask a question. You will, though, need to have input your audio PIN number in order to do that. So if you haven't already, when you called into the webinar today on your phone, when you call in the number, you should have also received an audio PIN number. You can put that PIN number in at any time. So if you see in the audio box on your dashboard, just type in that PIN number, follow those instructions, and then you'll be able to participate live via your phone as well. There's also, you'll see a little chat question box. Feel free at any time during the webinar today to type in any questions that you might have, whether they be of a technical nature, whether they be specific to any of the questions or information that we're relaying on the call today. We'll also be pulling up those questions throughout the call and giving them out verbally to the rest of the audience, and then when it makes more sense, if it's just a question specific to any of the technology that we're doing or something kind of on the side, you can feel free to send those in through that question box as well, and we'll get a response to you. If for some reason we get so many that we just can't get to all of them at the end of the call, we'll try to respond to you individually. We'll also have this webinar up for all of you on our website, so for all of your colleagues who were not able to participate live in today's call, you'll be able to do that or give them the link, and they can log into the website and listen to the call. And of course, you know, you can always access any of the staff at PCPCC. I think all of you already have our email addresses, but if you don't, you can certainly always send an email to myself at agibson@pcpcc.net, or certainly Tara Hacker can help you out. We'll have her contact information up on the screen at the end of the webinar as well. So lots of different options, lots of different ways that you can participate. So I'm going to go ahead and move on into our formal agenda. If you have any other specific questions, go ahead and type those into the box. Or if you're still having other problems, you can shoot one of us an email, and we'll get to that as well. You can also, if you have specific technical questions and you're having problems with the webinar, you can email Lauren at pcpcc.net, LOREN@pcpcc.net. So just a reminder to all of you who haven't had an opportunity to really be on some of our earlier calls where we went over in more detail about all of our centers. So we have 5 centers, and they've been reorganized over the last year, I think in a way that makes a lot of sense for everyone to really know what makes more sense for them to participate in these particular audiences or perspectives. Certainly if you have specific areas of interest, we hope that you're participating and you're on the email list for all of these. But they've been tiered out, as you can see, into different types of topic areas, and then also for different audiences. So we have centers on advocacy and public policy. Of course, today's centers on care delivery and integration. We have a center for employer and purchasers, one for outcomes and evaluation, and last but certainly not least, a center for patients, families, and consumers. And again, these are the areas where we're really looking to our leadership, and with all of your participation as we go through the work of our ongoing larger organization in each of the centers really are the thought leaders for all of us, and really working in partnership to make sure that we're achieving the mission of the board that they set for us and the vision for the overall organization. But we're really more than ever working hand in hand with the staff, and the staff really working with each of the centers to make sure that all of these objectives that we'll talk about today are executed in the best way. So what you might not know about each of our centers is specifically what we're calling our leadership cabinet. We have approximately 10 to 20 individuals that sit on each of our cabinets. Now, for the most part, the leadership cabinet is comprised of our executive committee members. And so for many of you, if you don't already know, we have 2 levels of membership at the PCPCC. Our executive committees, our dues-paying members, and those are typically large organizations that have a real stake in the mission of our organization overall. And then they also have the resources to help us do the work that we've accomplished over the years, and we hope to into the future. But then our public-facing side, which is our general membership. So anyone can sign on to get our communications, again, participate in calls like this. So it really creates an opportunity to have a very diverse group of stakeholders who participate in many different ways within our organization. Now, when there are specific gaps that we've identified, that we don't have someone from our executive committee that we need in a leadership role, occasionally the leadership will invite specific thought leaders to participate on our cabinet. So those are people to fill specific gaps, knowledge gaps that we might have, or expertise that we're specifically seeking out to balance out the leadership on each of our centers. And, of course, working in very close collaboration with all of the staff at the PCPCC. So the cabinet leadership meets on a monthly basis. As I mentioned before, they all met face-to-face in January, and then ongoing they meet about twice a year, but then in between on phone calls and webinars like this. If you have any specific questions about any of the individuals who are serving on our centers, on our leadership cabinet, please do contact Tara Hacker. She's our Director of Programs and our Principal Staff Person for all of the centers, and we'd be more than happy to direct you to that information. So moving on to slide number 4, I want to tell you a little bit about how we're communicating with the centers. So each of the centers has a dedicated web page that you see up on your screen now. Now, we do a really good job. Tara does an amazing job, along with Michelle, our Communications Public Affairs Director, about keeping information up to date on those web pages. So at any time, please do go to those and visit those pages, get all the latest information on what's going on in the center. We put summaries of minutes up on the web pages so you can find out what everybody's talking about. Calls like today's will be archived up on the web pages there. So it's a great, easy place, kind of one-stop shopping to find out what's going on each center. We also are going to have a lot more resources and links to lots of other organizations, other types of meeting material, and news updates. So lots of information that you'll be able to find on our website. I think many of you are probably already receiving communications from the individual centers, and we have been sending out more customized emails through each center. So many of you who had signed up for multiple centers, we're getting multiple communications that was similar, a little different. What we're going to do now is consolidate that information into one newsletter, so it's not as confusing, again, for those of you who are signed up to receive communications from multiple centers. So you'll only have to go and read one center newsletter to get all of the up-to-date information. Of course, that's alongside all the other general weekly communication that we send out through our complete list at the PCPCC. They'll give you more specific information on these center monthly updates about webinars that are specific to the work of each center. If they're co-sponsored by a particular center, we'll make note of that. But we're still keeping to what we've been doing in the past, about 2 webinars a month. And again, you can, if you're not already getting those communications, you can sign up through those center web pages. We also give you the option of signing up through our social media networks, Facebook and Twitter. So lots of different options to be getting those communications if you're not already, or to let your colleagues know about that. So moving on to the next slide, slide number 5. It will tell you a little bit more information about how the centers are fitting into our larger organizational structure. So you'll see that we have a few other facets to our organization besides the centers. We also have task forces, special interest groups. We have event planning, and that's the group of executive committee members who help develop identify the speakers and all the material and information, and basically the overall structure of our live conferences. And then, of course, we often have many publications that require either the leadership of individual centers to work on, or our separate task forces as we're looking across centers. So that just gives you a little bit of information about how all of that fits in. So I think I'm just going to go ahead and move it over to the co-chairs, because I don't want to take too much of your time. Again, with us today, we have on the phone, we have 3 co-chairs for our Center for Care Delivery and Integration. We have Blair Childs, who's Senior Vice President of Premier, Dr. Ted Epperly, who's Program Director and CEO of the Family Medicine Residency of Idaho, also a past president of the American Academy of Family Physicians, and Sana Kim, who's Director of the Division of Pediatric Practice at the American Academy of Pediatrics. They've been working with us very closely for quite a while at the PCPCC, so you are all in great hands, and they're going to do a great job of facilitating the conversation with you today. So without me talking too much longer at anybody, I think I'm going to pass it right over to you, Ted, to get things kicked off.
Okay, thanks, Amy. And again, I just want to echo Amy's thanks to all of you for participating today. It looks like we have about 62 folks on the call. And I just want to get rolling right into some questions to you, because it's important for us to know the answers to these as well. because of just some of the technology, there will be a limitation of the characters on your polling questions. Some of the questions that will pop up on your screen will be abbreviated. So I'm going to announce the full question and other optional responses while you answer, just so that they're clear to you. So if I'm talking while you're also reading, please understand why. First of all, we're going to start off by getting to know a little bit more about each of you. So please turn your attention to the polling questions that should be on your screen now. And if you can, just go ahead and click on the correct box for you that most accurately represents what is your current role in your organization. Is it as a consumer or patient advocate? Is it as a primary care clinician? Is it government employee or official? Is it work for a nonprofit professional or trade association? Or lastly, is it work in private industry or health plan? So I'll give everyone a few seconds to respond, and then we'll show you the real-time results in just a minute. And as you can see there, it looks like 42% of you said that you work for a nonprofit professional trade association, 36% work in private industry or healthcare or health plan, about 11% each in primary care or government employee or official, 6% consumer patient advocate. So thank you for that. The next question that I have for you is, why are you interested in participating in the call today? Is it to learn more about how to become involved in the transformation of healthcare delivery systems through advanced primary care? Is it to have a dialogue with primary care delivery experts in the field? Is it interest in how many primary care medical homes can be involved in building a medical neighborhood? Is it to provide input and direction into how the PCMH is messaged to clinicians and organizations involved in practice transformation? Or is it some sort of other answer? And if you just go ahead and click on the box. And again, this will be for all of those that apply. Okay, as you can see there, it looks like 71% are to become involved in transformation of healthcare delivery. That's great. That's exactly what this center is all about. 31% learning how medical homes can work in medical home neighborhoods. I think that's really important. 20% because of dialogue with primary care experts that we can talk with and to on these calls. Provide input into medical home messaging for primary care, 20%, and other at 14%. So thank you for your feedback. I'll be back with you in just a minute, too, about some other questions. And I hope that, again, this call meets those interests. So Blair, I'm going to go ahead and turn it over to you now, and you can provide a little bit more detailed description of our center.
Great. Thanks, Ted. Welcome, everybody. I don't think there's much question in everyone's mind that we're undergoing dramatic change in our healthcare system today, probably the greatest change that we've ever experienced in the system. You know, the role of PCC has been to really advance the medical home, but really as part of this effort, it's how do we integrate it into the overall healthcare system and the transformation that's occurring. So that, when we met back in January, as Amy alluded to, we had a discussion about really what was the purpose of this center and what were the kinds of things that we were going to undertake, and that's what I'm going to walk through here with you all today. So essentially, in this time of significant change, we thought really what we should be focused on is really communicate, advocate, and educate. So communicate about the transformation that's going on and to encourage its transformation in the healthcare delivery system. Advocate for, you know, really development of medical neighborhoods, greater coordination, integration of care overall, with the foundation of primary care at its heart. Identify and share, you know, the kinds of models that are working out there, and then really develop resources that can help our members in the healthcare system broadly achieve this transformation. So that's what we discussed as sort of the charge of this group. In terms of who we are targeting to participate in this, and I can see from the survey question that we've got a good selection. Go to the next slide, please. That we've got clinicians and other members of the healthcare team that we hope to have involved, administrators in healthcare, and then really folks that serve the industry and who are experts overall from the standpoint of SMEs, et cetera, that when it comes to HIT and practice transformation overall, as well as sort of the individuals who are involved in training and education in healthcare. So the last few categories relate to that. Going to the next slide, this is the group that participated in the meeting that Amy referred to back in January. So this is the guiding group. As you can see, it's really representative of the cross-section of organizations in healthcare. It's terrific. It's one of the great assets for PCPCC is that it involves providers, it involves physician organizations, companies that serve healthcare, payers, patient advocacy groups, measurement organizations. So we've really got a terrific cross-section of parties involved in healthcare, and I think that's one of the great strengths of this organization. And I think this the leadership team that's been assembled for this group that's helped craft the direction and purpose of this center really is representative of this of the organization and of really healthcare broadly. Going to the next slide, sort of specific objectives that we have for this center. First is developing resources to support the patient-centered medical home transformation and this idea of integrating it into this medical neighborhood. So creating these resources, developing resources that identify, the role of the patient-centered medical home and its care coordination and customization for care teams. So specific resources for care teams, patients, and families. And then I think specifically talking about the role of HIT within this system. So those are the three areas that we thought were important and areas of focus for the center from a strategic standpoint. So let me turn it to Suna, who's going to take it from here and walk you through a few other points about the retreat and what we've been trying to accomplish. Suna?
Thanks, Blair. So as both Blair and Amy mentioned, we met in January with members of our leadership cabinet, and we talked through each of the strategic objectives that Blair just outlined. So one of the goals from that meeting was to further flesh out each objective and then to identify activities or tactics under each of the objectives to move them forward. So my goal right now is actually to share some of the discussion related to each of the tactics so you can kind of understand the background behind how these ideas originated. So the first objective being develop resources to support PCMH transformation and integration into the medical neighborhood. While we kind of felt like there were already many organizations in existence, probably some of your organizations even, that are working on this objective. However, what is it that the PCPCC is uniquely qualified to address, and what gaps potentially is the PCPCC able to fill through our center? So the first tactic that we came up with is defining terms and developing constructs for integrated systems, accountable care organizations, and medical neighborhoods. We discussed the fact that there were a number of terms, even the word integration, that required better definition. I think people think different things, and what we were thinking is that some of those core features of a well-integrated system need to be defined so that everybody understands what those pieces mean. How do the pieces within the medical home neighborhood work together? What does the medical neighborhood include, and does it extend beyond just specialists and include community-based resources? And might it not need to include those resources if we're going to be addressing all biopsychosocial needs of patients and families? So we've also discussed that not all ACOs include a strong patient-centered medical home at its core, and that there's actually no consensus on the definition of an ACO. So the cabinet felt that the patient-centered medical home should be at the base of an ACO and other integrated delivery systems, and that should be defined. So that's the first tactic that was discussed. The second kind of goes along with that. That's to develop a medical home framework within the neighborhood, micro to macro perspective. So along the same lines of defining the terminology, a suggestion was made to develop almost a schematic or framework. So and it would kind of illustrate all of the constructs and how they relate to one another. For example, one possibility that was brought up is that the schematic might be in the shape of something like a target with the patient and family in the center, a medical home team in the adjacent outer circle, subspecialists and members of an ACO within the next outer circle, et cetera. And then concepts such as care coordination and the influence of HIT might also be represented in such a schematic. And some people are just more visual, and having a picture like that may help to really kind of make the whole concept concrete for people. So that was another idea that was brought forward as something the center could work to develop. The third suggested tactic was to collect case studies or data to demonstrate primary care medical homes as fundamental to integrated care. So the case studies could illustrate and provide concrete examples of well-integrated systems, and also systems that have reaped benefits of having a strong patient-centered medical home at its foundation. And the final suggested tactic was to actually disseminate these case studies and data to Congress and also to other organizations linking medical homes to medical neighborhoods. So we would just, in essence, take this information gathered, potentially even collaborate with our Advocacy and Public Policy Center to conduct activities like Hill briefings, as well as reach out to other organizations that aren't currently engaged in medical home work to bring them on board. So that's an overview of the tactics, and I'll turn it over to Ted.
Thanks, Anna. I appreciate that. So, folks, we're going to have you return to the polling questions now. And so the question before you at this point now is, what do you individually believe to be the #1 priority of tactics from Objective 1? That Objective 1, again, was to develop resources to support the PCMH transformation and integration into the medical home neighborhoods. So again, those choices would be, first, define terms and develop constructs for integrated systems, accountable care organizations, and medical neighborhoods. Choice 2, develop medical home framework within the neighborhood, micro to macro perspective, as Anna mentioned. Number 3, collect case studies / data to demonstrate primary care medical homes are fundamental to integrated care. Choice 4, present case studies and data to Congress and other organizations linking medical homes to other medical neighborhoods. Or maybe we missed it altogether if there's an other that you think is more important. So go ahead and take a moment and check the box. Just one, please. And we're just waiting for those results to come up. And as you see there, the majority of you felt that, or at least 38%, I should say, felt that develop medical home framework within the neighborhood is the first choice. 31% felt as the second choice, define terms and constructs for integrated systems and the neighborhood. 23% felt collect case studies and data on value of primary care, and 8% inform external organizations of medical homes value in the medical home neighborhood. So I'd like to just kind of maybe kick off a little bit of some sort of discussion here. As you saw, the majority chose medical home framework within the neighborhood. Perhaps I could ask, why do you believe this is of highest priority?
you'd like to speak on this, you can raise your virtual hand and we'll unmute you so you can share your thoughts.
And Lauren, who was just speaking, is watching all your virtual hands out there. So again, I'll just let Lauren chime in when he's got one.
All right, here's George Patron. You're unmuted.
Hey, hello everybody. Yeah, Dr. Patron here. Well, actually, Ted, I didn't click along with the majority of the responders to develop the framework because I feel it's so crucial to get the message out that this is of value, that I was in the 8%. The other top three are all very important, but we know, those of us tuning into PCC and already working with medical homes, and the belief that they need to come within an organization, a neighborhood, if you will, that it needs to happen yesterday. So I just throw my 2 cents that I think it's so crucial to what PCC is doing to inform organizations out there providing medical health care, that it's crucial to put this in place no matter what you call it, no matter which model you want to try to aspire to change the way we deliver health care, not only in primary care, but throughout the health care with the specialists as well.
Okay, George, thank you. That's a very important comment. Other comments at all? Perhaps are there other things we're missing as well?
Michelle Hill, I can unmute you, but first you have to enter your audio pin under your audio panel. You hit pound and then that pin number and pound again, and that way we can unmute you so we know where your voice is coming from. Also, if any of you have any opinions that you'd like to answer, put in the question box, we can speak your thoughts as well to the group.
This is Sana Kim, and I perhaps have a follow-up question for Dr. Patron, and that is, are there specific organizations that you feel really need to hear this message that perhaps aren't engaged at this point, that might be kind of prioritized groups that our centers works to reach out to?
Well, am I unmuted now?
Yep, no, you're still unmuted, yep.
Okay.
Yes.
Well, I appreciate your asking me the question as opposed to the speaker. Yes, Suna, I have found that as I retired from the Army, I am getting more and more people calling, emailing me, asking how do I access health care. And, 23 years in the Army and working with TRICARE and the networks out there commanding, even the organizations who get it, who are beginning the transformation, when you get down to the patient level, they're clamoring to figure out how to get this kind of health care. And aside from the military, I find that family and friends will refer people to me saying, how do I access this kind of care? And I'm always giving them the terms, giving them the concepts and saying, this is what right looks like. Let's see if we can help you find it. And so there are great organizations. Washington State, Oregon has programs. We heard about from Pennsylvania here recently, and all that they're doing to put information, education out to the medical schools. And yet there's so many people that are not able to access it. So I guess in answer to your question, I believe all of the major organizations, not only in the delivery organizations, but also in the payers, which of course is what our conferences are all about, is bringing us all to the same table and saying, how do we put together the accountable organization to deliver this kind of health care which beats the triple aim and so on. Not sure if that answers your question, but I think every organization already doing it, we have to look at their capacity and get more patients to talk with their feet, if you will, and try to move their health care to these organizations. And then those who are afraid to take on the risk of doing this will get the message faster.
Thank you, George. Lauren, were we able to unmute the other person? Maybe we'll take one more question on this, and then let's keep us pushing along here.
Okay, we have a question from Michelle Hillis and then another from James Shrewport.
Okay, thank you.
Hi.
Michelle.
Good morning. Good morning, everyone. It's Michelle Hills from New Directions. And one of the challenges, I think, in establishing the medical neighborhood is the consideration and importance of integrating behavioral health. Most of the NCQA accredited PCMHs do not have a formal behavioral health strategy in place, and even fewer PCMHs have a co-located behavioral health professional. So I believe that this can be a really important center for promoting the development of the medical home neighborhood as it pertains to behavioral health.
You know, that's an excellent point. In Boise, Idaho, where I am, we've integrated mental health and behavioral health into our patient-centered medical home. We're a level 3 here. And I can tell you that the two go hand in hand. You know, the body and the head are not separate. They're connected, and they're connected by the neck. And I see the PCMH as being a connector of body and head. And so excellent point, and well taken in the sense of what we will work towards. Patients very much appreciate having their mental health and behavioral health issues addressed in their medical homes, as opposed to being sent to other areas where they may not have that relationship with folks. So I think that integration is a key point that we'll be working towards. Thank you, Michelle, for that.
Do we have time for one more, or should we move on?
Yeah, maybe one more quick one, and we'll move on.
All right, James, you're unmuted.
Hi, this is Jim Schuppert from Corning, and I guess 2 points. I did vote for the framework for both the medical home and neighborhood because I think it is important to have consistency with the message of what is and is not. And as a payer, you know, I think what we want to do is obviously pay for value. So I do think having a framework and that common sort of understanding, not that that can't develop over time, but I do think it helps with the consistency. The other point, I guess, in the other column, I do think better communication about what a medical home and neighborhood is. When I talk to people, I think there is a lot of either misunderstanding or no understanding of what a medical home and neighborhood actually means. And I think that the organization would be well served to develop some better communication tools for the broad audiences that you're trying to obviously reach out to.
Thank you, Jim. Excellent points. And again, we're recording all of these points, and we will work these into what we do in the future as well. With that, I'm sorry, I know there are probably other questions on this issue, but I'll keep us moving. And Sana, we'll move it on to you.
Thanks, Ted. Okay, so our second strategic objective is to develop resources that identify the patient-centered medical home's role in care coordination and customize for care teams and patients and families. So this objective is really about helping to ensure that members of the medical home team are adequately trained and prepared to deliver care. So you'll notice that some of the tactics relate to helping to ensure that education and training programs are structured the right way and include a focus on interprofessional education, while other tactics relate to ensuring that existing medical home workforce has access to best practices and other high-quality resources. So the Cabinet actually identified the following possible tactics, and I'll kind of go through each one and give you just a little bit of a sense of what the discussion was like. The first is to support the Education and Training Task Force in building a database on health professional and training programs for advanced primary care. So in the former structure, there was actually an Education and Training Task Force. Those activities now fall under our center. However, some of their work is ongoing. They are focused on gathering and creating an online database of programs where advanced primary care is being taught and where competencies are cross-disciplinary. So one proposed tactic would be to help support this effort by encouraging submissions and getting the word out about this database. The second tactic is to encourage promotion of interprofessional competencies within accreditation standards. So this could be done by advocating to the accrediting bodies such as the Accreditation Council for Graduate Medical Education or the Association of American Medical Colleges about the importance of incorporating the patient-centered medical home into training programs. The third is to solicit video contributions from providers or patients to highlight stories and tools for medical home best practices. So members of our cabinet felt that videos frequently resonated more strongly than written materials, and cabinet members tossed around the idea of soliciting videos that outlined practical elements of implementing the medical home, and even the possibility of giving an award for best practices at the National PCPCC conference. So that's the third tactic. The fourth is to develop and share resources and tools for best practices on PCMH transformation. So this tactic really kind of more relates to developing an online clearinghouse, which would house tools and resources for PCMH transformation. So one very concrete example of this might be a blueprint for a primary care office and how a new office might be physically built to maximize team communication and patient-centered care. So that could be one of the many resources that are housed in this clearinghouse. And this could go a long way, especially if a practice receives funding to help build their medical home practice infrastructure. This could be a place where people look to find existing resources around these areas. And this is probably something that a lot of tools and resources are already in existence. So PCPCC and the center would go about compiling those resources, identifying gaps, and developing any necessary resources to add on to that. The final tactic is to serve a convening function for medical home technical assistance organizations. So there are a lot of people out there who are providing technical assistance to practices directly about practice transformation. PCPCC, I know, was involved in a meeting where a lot of these organizations got together. So potentially, the PCPCC could work to serve in that convening role, bringing these organizations together, learning a little bit more about what's taking place at the practice level and what are the major barriers or issues that the technical assistance organizations are seeing within practices. So that could be more of an information gathering opportunity for this center so that we can then figure out what other resources might be needed. So those are the 5 tactics, and I'll turn it back to Ted.
Okay, thanks, Sana. So again, if you can man your polling stations now, and what you're going to see before you is, if we can solicit your vote again then on what is your #1 priority of these tactics that Sana just presented for objective number 2, which is, again, to develop resources that identify PCMH's role in care coordination and customize for care teams. So if you could take a look at those 5 options. I won't read them this time to save time. I think they're there pretty clearly for you. And just go ahead and select the one that is the most important to you. And while we're waiting to see the numbers come up, I'd just like, once we see that, for somebody that feels comfortable to speak to why you feel that the #1 item was the #1 item. And as you can see there, the majority felt that developing resources on transformation best practices would be most helpful. You can see the array of other scores, and I just open it up to anybody that would like to speak to that.
Again, by raising your virtual hand, we can unmute you right away. All right, Mariana Webb.
Hi, this is Mariana Webb. I'm the Executive Director of a small physician hospital organization who's been very actively working on patient-centered medical home. The reason I had voted for the interpersonal competencies, because I feel that if it becomes a standard part of board certification, that this will encourage primary care physicians who maybe are the laggers to go ahead and get involved in this, in developing the patient-centered medical home and in learning how to work as a team rather than the dictator.
You know, Mariana, this is Ted Epperly again. I'll just respond to that. It's a great point. Both Paul Grundy and I sit on the ACGME Board of Directors, and I know that two of the things we've talked about is to make sure that across all residency programs in the United States, that patient-centered medical homes and neighborhoods and accountable care organizations and integration and coordination of care are put into the DNA of all of the accreditation standards. So we'll certainly work very actively to try to make sure that, to your point, that those interprofessional competencies and teamwork and how this needs to be a part of the fabric of all learning going forward, at least on the medical education side, happens. I think on the nursing side, hopefully we'll get folks to step up to the plate as well, because it is an interprofessional team. So with that, I'll stop on that. Lauren, is there anybody else with a question?
No one yet.
Okay. I think for time reasons, we'll just kind of keep pushing. And so, again, Sana, I'll push it back to you.
Okay, thanks. So our final objective is to communicate the value of health IT in the medical home for health systems and other stakeholders. I think everybody knows that while a practice's ability to transform is not dependent on health information technology, HIT is definitely an enabler of the medical home and helps to make things easier. So there are 4 tactics that were proposed under this objective, the first being to identify components of HIT that are most important to medical homes. So we know that EHR systems have their limitations and they're not perfect tools at this stage. However, there are some key features and functionalities within existing EHRs that are not being fully leveraged to support care within the medical home. So this proposed tactic might involve a specific activity such as crosswalking meaningful use and PCMH standards to illustrate how HIT supports the medical home. So that's the first. The second is educate patients and families about features of HIT and medical home using case studies and stories. So cabinet members felt like patients also needed to be taught why HIT is important. Not all patients and families have a computer at home, and so it can be challenging for them to grasp how health information technology can help facilitate their care. So that's the second proposed tactic. The third is to inform vendors on how to make HIT more user-friendly for patients, families, and healthcare practices. So we know lately vendors are heavily focused on meaningful use. There are some things that are central to the medical home that are not currently being addressed by vendors. So some examples might be care coordination functionality or population management functionality within EHR systems. So this tactic is proposing that our center could reach out to HIT vendors to advocate that these functionalities be addressed. And our final tactic is to collaborate with the MGMA on HIT, meaningful use, and medical home. So one individual noted that MGMA has actually done quite a bit of work around HIT and its linkage to the medical home. So this tactic would be to collaborate more directly with the MGMA as a targeted partner on some of these activities. So Ted, I'll turn it back to you.
Okay, thanks, Sana. So again, folks, we're going to get your thoughts on this. If you could just take a look again at the Objective 3 that Sana just presented the tactics for and give us your first priority. Again, this is on communicate the value of health IT in the medical home for health systems and other stakeholders. How do we best make this happen from your perspective? And of course, you see the 5 choices there. And if you'll just take a moment and click on that. And then again, I'd like to ask one or two of you, if you don't mind, to articulate why. And as you can see there, identify HIT components most important for medical homes received the first place number of votes, followed pretty closely by informed vendors on how to make IT more user-friendly. So I'd just open it up to your thoughts in terms of comments. Any virtual hands, Lauren?
Yes, Dr. Patron is with us one more time.
Okay. Go ahead, George.
Well, if I may, again, I find I must think a little bit differently. I agree with all the things mentioned there. I actually checked educating, and I would have said educate everybody, not only patients and families, but providers. Having the tools out there, getting vendors to produce them, I've always said, if we can't do it on a paper, we're not going to do it with Electron. And this has to do with I'm sorry, can you hear me?
Yep, you're back.
Sure.
We can hear you now.
Okay, I got a recording came on. But at any rate, the processes and highlighting what our patients and families have, I just believe is more important to getting us going, educating them on whether they're going to use the old-fashioned method of calling on the phone or use a secure method of messaging and so on. I think when we stop ourselves until we get the money to buy technology, it slows us down. So it is very important to use technology, but we've got to remember patient-centered, family-focused, and simplify it and go with the things that we already know work. And I put a chat comment in that a great OBGYN, Dr. Holly Bowen in the Army, had said that she still uses her shoebox to keep track of which patients need follow-up and how to communicate with them in a timely manner. So.
And Tom Brewster, we can get to you if you could also put in your audio pin. It's under your audio tab there. You just hit pound, then that pin number, and pound again. That way we can unmute you. And then Lauren Agortas has some questions, written questions and comments, if you want to read those.
So Ted, I can read that one. This is Sana. So
Yeah, go ahead, Sana.
Okay, so Lauren typed in a question saying, research indicates that HIT is effective in elimination of medication administration errors. It's also a good tool. Also a good tool for patients is free online with med prescriptions, what's used for, and a checklist for a pill organizer at www.myMedSchedule.com. I don't know that that necessarily is a question.
Yeah, sorry about that.
More than a good suggestion.
Yeah. So I think Tom Brewster took his hand down, so others, anyone else? Here's James Shubert again.
Well, I'm trying to, are the poll results back up? I think the HIT components from my point of view is the most important, and I think you could break that down into different, I guess, stakeholders. Part of, I think, the value and challenge of medical homes is to prove their worth or value. And so I think identifying those components, whether it be for the patient, the physician, or the payer, is going to be critical for the success of the medical home and medical neighborhoods.
Yeah, well said. Can't disagree with that. Lauren, is there anybody else? Otherwise, we'll move on to our last polling question.
Yeah, I think that's about everybody, so I think we're free to move on.
Okay, thanks. And folks, again, thanks a lot for your time and attention here. We'll move to our last item, and up before you comes our last question we'd like to have you participate with us on, and that's to prioritize the tactics that we've identified as the number one from each of those three objectives that Sana have just reviewed with you. Of course, we have those three objectives, and it looks like, have we typed those in, Lauren, yet? The number one from Objective 1, the number one tactic from Objective 2, and the number one from Objective 3, because what I'm going to ask you folks to do is help us prioritize the number one overall tactic for us to focus on. That'll help us as co-chairs and the PCPCC leadership make sure that we're on this with care delivery and integration. And it should be coming up here just shortly.
Yep. It's up now. Yeah, there's one from each of the three objective questions, as well as a couple when they were within a few points of each other. So there's a couple that have two from the question. So if you could all vote now, that'd be great.
Okay, I see. So what's before you now? If we could just have you select what you believe personally is the number one priority for our entire center to focus on. All right, and as you can see there, developing resources on transformation best practices received the first vote. That's an important thing to know because, again, that puts us into an educational role, not only to collect those best practices, but to broadly disseminate them. Receiving the second place was developing medical home framework with the neighborhood. That'll be very important. That's right at the heart of what the center is accomplishing and trying to do as well. I'll stop right there. You can see the others that received by far fewer percent, and open it up for any final discussion on that point. Otherwise, we'll move it back to you, Amy, to kind of close. But I'll stand to see if there are comments on this. And Lauren, help me out if there are.
Not anyone as of yet, but raise your hand and you'll be unmuted.
Ted, this Blair, that when I think we're all trying to figure out what's working and what's not, this really makes a lot of sense for us to focus on. So I like that as a top priority personally.
Yeah, this is Amy. I totally agree, and I think this is something that, as an organization, we've done pretty well in the past, and we have such a great network and great diversity of stakeholders that are so willing to share their best practices and tools with us, and we'll continue to do that through webinars and through our conferences and through our publications. But I think as we move into focusing on the role of the medical home within the medical neighborhood, it'll be important to talk about those best practices as well, and talk about how they're being developed as a foundation for accountable care organizations. So as Sana had described, from the micro level at the practice level all the way up through larger organizational partnerships and collaboration. So I'm really excited to see that everyone still thinks that should be a priority for the organization as well.
And I agree. This is Ted again. It's back to a comment that Michelle Hill had made earlier about the integration of mental health and behavioral health. Here's an example of a best practice that we could bring back to you in terms of practices across this nation that have figured this out a bit more and can share broadly back as a best practice, because all of us on the care delivery side are dealing with that issue. How do we make sure that mental and behavioral health are integrated well? So that helps us a lot. I'd just like to echo both of Blair's words on that, and Sana's from earlier. This helps us focus on what we can bring to you. Sana, any further comments from your perspective before Amy closes out?
No, I just that I really appreciate this feedback. I think that I personally agree with the prioritization as well, so personally pleased how it all turned out.
Yeah, and thank you all again so much for participating. You know, we're trying to find and explore other ways to get your input, but again, even after the call is over or into the days upcoming, please don't hesitate to send any of your comments or questions about what's going on in the center, or if you think about some other tactics that we might want to explore, some other partners, we certainly want you to send those to us. Again, you can email me, give us a call, and you've got Tara's contact information up on the screen as well. We do have a quick survey that we are going to send to all of you at the close of this webinar. So if you could just take a few minutes to answer a few other questions. Again, we really want to get you as involved in the work of the PCPCC as we can, and we certainly encourage you to participate on future center calls as we move forward. So we are at the top of the hour. I want to thank so much our co-chairs and certainly all the staff at the PCPCC for helping put all this information together for you. Continue to check on the website, as we'll continue to post updates there as well. So thanks to all of you, and you will be seeing more information coming out from us about the center very soon. Thanks, everyone. Bye-bye.